Hello, it's Andrew Eborn here with Lives on Lockdown. I'm delighted that yet again my guest is Claire Nightingale, Orthodontist of the Year, and we're looking at the future of dentistry and orthodontics, and in particular how AI can assist. How are you, Claire?
Yeah, I'm good this morning, Andrew. Thank you very much.
You're looking great and even more rosy than when I saw you last time.
Good night's sleep.
It's got to be good. So tell me, we've been looking at, through a number of professions, the developments from a technological point of view, and in particular, artificial intelligence, AI, and how that can assist. How are things coming along in the field of AI and developments from a technology point of view with orthodontics?
Well, I think there's some very exciting developments in orthodontics, in actual fact, and this period on lockdown has given me a chance to understand a little bit more about it, and also, of course, reflect on the importance, because we're all looking at how we can deliver dentistry and orthodontics. Of course, orthodontics is my particular interest, with as minimal patient contact as possible. So just before we went into lockdown, in fact, in January, I'd started to engage with this, and I had started trialing 5 patients on something called dental monitoring. And of course, during this period of lockdown, I've been able to monitor their progress, and I'm really quite wowed by it.
And that's one of the great things about lockdown, is that it's forced people, to the extent they might need forcing, to look at technology and see how that can assist dealing with people remotely.
Absolutely. So I thought what I'd like to do is I'd like to share with you the patient journey, how it's worked for one woman in particular, and I will just at this point emphasize that she has of course given me her consent to share her photographs and comments, I'd like so I anticipate that the way she's been treated is going to become more the norm in the future. So let's see if I can begin by sharing you some images. So what we're going to do first of all, I'm going to share with you her start photograph so that we can understand the sort of problem that we're dealing with. So here we have a beautiful woman who's just looking to improve her smile ahead of a wedding, which is going to be quite soon. So she's looking for treatment that's going to be simple, aesthetic, predictable. Now, from an orthodontic perspective, you know, let me tell you what I see. And I see someone with a very beautiful face who has actually a very slight asymmetry of her lower jaw, with her chin point fractionally off to the left. The reason why I'm drawing that to your attention is significant in assessing her bite. So we look at her teeth next, and we can see that she's got a little bit of crowding in the bottom, a little bit of crowding in the top, but her occlusion, or her bite, is not ideal. So what we have here is we have front teeth that aren't meeting properly, with a slight gap between the teeth, so we call that an anterior open bite. On the right side of her teeth are biting together quite well, but on the left side of her teeth, she's got something called a crossbite. So this is called a unilateral crossbite because it's only on one side, and the top teeth are biting on the inside surfaces of the lower teeth. Now, as part of my treatment planning, I have to decide what is realistic about meeting her treatment expectations. So of course, I want to give her beautiful straight teeth, but I also want to improve on her function as much as possible. So I want to find a way of not only making these teeth straighter, but at the same time improving on this anterior open bite to give her some proper contact between her front teeth so she can bite into fine things like lettuce, for example. On the other hand, I've decided that I'm not going to worry about this crossbite on this side. The reason for that is A, correcting it isn't actually going to give her a functional or aesthetic benefit, but perhaps more importantly, the problem is actually because of the slight asymmetry of the jaw. And orthodontists move teeth, but we don't move bones. Orthognathic surgeons move bones, and her problem is not sufficiently significant to discuss that as a solution. So
it's a really important point on that, isn't it, Claire, is that people understand the difference, is that you're not breaking jaws yourself. You might need to for certain patients, but you would work in conjunction with other departments if that were necessary.
Yeah, absolutely. And that, as an NHS consultant, that's obviously a large part of the role I play in the health service, and I work with a fabulous team. So we discussed her clinical presentation, we discussed her treatment objectives and aspirations, and decided that we would sort out her problem with clear aligners, of which my preferred option is Invisalign. So let's just talk through the journey about how the next steps.
And the great thing about this is, I mean, once you've had the initial consultation, obviously you can then do everything remotely and just bring in. So even a period of lockdown, the correction procedure is not being halted.
Yeah, absolutely. So I had actually wanted to show you how we take a scan of her teeth. Let me just give that one more try. The screen didn't pop up.
That's the joy of technology. The one thing you can always guarantee is, however good and however new the technology is, there will always be that tricky moment when you're trying to demonstrate it. But it's
right, here we go. I think I've now, so what I want to do, I just want to play you a few seconds from my practice video. So here we have a young patient in the chair, who happens to be my son. And here we have one of my members of staff, who's my orthodontic therapist. And in the background, this is my scanner. So this was an investment that I made over a year ago now, and it's called an iTero Element Scanner, and it's produced by Align Technology. And here is the digital scanner that she's about to pop in her mouth, and you'll see his teeth image come straight up on the screen. So let's give this a try.
State-of-the-art technology. This is so cool. This place really invests in their patients.
Right, okay. So
he's brilliant. He's so good. A shout out to your son. What's his name?
Harvey, little Harvey.
Harvey's a star.
He might be coming down the stairs in a minute. It's a bit late on the homeschooling. Anyway, so we get the idea. So we take a digital scan, okay, and we send that over the internet. And as part of the investment in my practice and embracing new technology, back in November, I did upgrade to 100 meg leased internet line because my internet connection was absolutely shocking. And I could see that this is the way we were going. You know, increasingly we were starting to need to look at large volume cone beam CT scans, for example. And I wanted to start trialing dental monitoring, and I knew that in order to ensure that that went with ease, I had to have all the right building blocks in place. So I've made significant investments in the infrastructure of the practice. So off that scan and patient photographs go to Invisalign, and then I spend some time constructing a ClinCheck, which is a model, a virtual model of the proposed treatment plan. So that's what I'm going to share with you next.
Okay.
So here we go. So as way of explanation, I'm going to explain to you that this obviously is at 0. This is the patient's presenting malocclusion. These are her top teeth, these are her bottom teeth. Now these little pink blobs on her teeth are called attachments. They're not pink in real life. They are white tooth coloured attachments of glue, dental adhesive. Now their purpose is to alter the tooth surface so that the force applied to the tooth by a piece of plastic becomes more efficient, because of course otherwise what we're relying upon is a bit of plastic to wrap around a smooth tooth surface, and there are inherent problems with that. So these attachments have been designed, you can imagine this, so there's a force going to be pushed against this flat attachment surface here, there's another force going to be pushed against the flat surface of this attachment here. And the net result of that is going to create a moment that is going to move the crown of the tooth this way and the root of the tooth that way. So there's a lot of thought goes into the design of these attachments. Now, in addition to that, you can see that there are some numbers in diamonds, and this is a small amount of tooth filing that I need to do. So because these lower teeth are crowded, and because my treatment objective is to retrocline them, I need some space in which these teeth have got to move. So there's not sufficient crowding to justify taking a tooth out, for example. So I'm just going to reduce the width of the teeth in their contact points, so i.e. where the teeth touch, fractionally. And then you'll also see that there are some little blue lines, and the reason for that is that I'm going to get this patient to wear elastic bands to her teeth as a means of pulling the lower teeth backwards and the top teeth forwards. So If I spin this around, you'll see that this is called a cutout, and there's enough space on the tooth surface enamel here, so I'm going to bond a little button on here in due course, and the patient is going to wear an elastic band running from the button to a little cutout on the aligner. So I've given you the explanation of the diagrammatic visualization of her treatment, and now what I'm going to do is I'm going to play you the movie so that you can see how her teeth are going to move. So off we go. So how do you like that?
Well,
So
it's quite incredible, isn't it? It looks phenomenal. So you can see over a period of time exactly how the work should be progressing.
Yeah. So I can tell you, in fact, one thing I omitted to tell you is that at the bottom we have a timeline. So these aligners are worn sequentially. So she needs 16 aligners to go from A to B. Okay, so that's great. So now what I have done, of course, is I've kept my treatment objectives to be reasonable and achievable. So there we go, we've got some smart objectives going on here. And as I explained at the start, I have accepted the unilateral crossbite on the left-hand side. So I've improved the anterior aesthetics. Let's have a look. So here we go. So look, I'm intending to correct the key tooth, which is the canine, but the rest of the unilateral crossbite I'm leaving unaddressed. Now, of course, we can also show the patient different views of their teeth. So here we go. I can say, you know, here is the bird's eye view. Let's see how your lower teeth are going to shape up. Likewise, I can show the top teeth, you know, so the top teeth perhaps have got more of a visual impact to the patient. So let's have a look at what happens here. So we can see that's what's happening. So what the wonderful thing about this technique is that I can actually stop teeth moving that don't necessarily need to move. So I don't want these back teeth to move, in fact, because I've made a clinical decision not to correct her crossbite. Okay, now unlike using a fixed brace where all teeth move at the same time, using treatment with clear aligners, I can make the tooth movement more efficient by stopping unwanted tooth movement. And indeed, I can show you by superimposing where she started exactly what the tooth movement is. So
that's
you can,
clever, isn't it? So you can instantly see, yes.
So you can see that blue is where she started and white is where she's finished. So what I have done here, I've very deliberately planned exactly which teeth I want to move. And I've left the teeth I don't want to move undisturbed. And therein lies an efficiency with this treatment mechanics that we can't achieve with fixed braces. Okay, so in fact, we might as well show from that perspective exactly what's gone on the bottom. So here we are, that's where we started and that's where we finished. So you can see which tooth is going to move the most. From this.
And the efficiencies, Claire, the efficiencies that this introduced. I mean, it's firstly the efficiencies of timing, because obviously, you know, everybody's managing expectations as to where you should be at a particular time, but also having the patient not necessarily need to come in to see you each time. They can do lots of things remotely.
Absolutely. So, and indeed, in terms of managing expectations, unlike treatment with a fixed brace, where I might say to someone, well, your treatment's going to take maybe 18 to 24 months, you know, give or take a few months. What I can actually say to the patient, now this is in terms of old technology, because of course we're going to come on to the next development in one moment. But when I started out with my Invisalign training, we were told that patients had to wear their aligners for 22 hours a day for a fortnight at a time, and then they would move on to the next one. So it made the maths very easy. So here we are, 16 aligners. So I'd say to the patient, okay, so that's 32 weeks of treatment, which means that in just under 9 months, you're going to get the treatment outcome you want, assuming that you cooperate and you wear the aligners as instructed. So that's a very clear goal. A nice timeline. And I would also say to the patient, however, at the end of that first cycle of treatment, we will reassess your needs. And if the treatment outcome doesn't meet your expectations and it's feasible to improve it, we will go into a second cycle of treatment. So all of that has always been factored into the plan. Okay, so now with the next step in progress virtual technology, we can now set up for the patient to scan their own teeth at home. So every single week, they now can scan their teeth, and that image is uploaded into the cloud. It's assessed by a computer, AI. I can then look at it as well. And now what can happen is a bespoke treatment plan about when that patient moves to the next aligner can now be given to the patient. So rather than saying to them, in 2 weeks you change your aligner, the AI might say, after 5 days, oh, the aligner has now expressed itself, you're ready to move on to the next one. Or it might say, you're not quite ready yet, give it a few more days and scan in another 5 days. So we now get a treatment plan so we start off with a bespoke treatment plan tailored for the individual, but now we have a timing and a monitoring that's also bespoke for the individual. And that is what is very exciting. So on that front, what I want to do now is I want to share with you how we do that. So, okay. So now what I'm going to do, this is a slightly, this is a video of my staff when we were training. So let's see if I can, this is the kit. This is a retractor. So this goes inside the patient's mouth, and this is called the scan box. And this is the gadget into which the patient inserts their mobile phone and starts to record their own teeth. So let's see if this works.
I can just get you to pop your cheek retractors in, make sure the magnet space on the outside perfect.
Double tap to continue.
And then what I'm going to get you to do is if you can just get this to attach to the 2 magnets and keep a hold of that, of the box. Is it you all latched in? Mm-hmm. Yeah? Perfect. So now I would recommend doing this in front of a mirror to start off with.
Double tap to continue.
And if you just double tap the screen, it will give you visual instructions from now.
Your back teeth and keep your teeth together. Double tap to continue.
So we double tap there.
Bite down. Shift the scan box to one side.
Slowly to one side. Yeah. Perfect.
Now shift the scan box to the other side.
Perfect. Keep going. Perfect.
Back to the center.
Perfect.
Right, okay, so it was a little pixelated, but you get the gist.
Really get the gist. Now, in the pixelation, it shows it so easy. So you give people that device to take home, and they then monitor it accordingly today?
Absolutely. Yeah, okay, so now we'll see where that is received.
And again, that's the great thing about it, because you only have the initial one. Once they've learned how to do it themselves, then they're at home for several weeks, as we have been in the current situation. And they can continue their treatment without having to obviously travel in to see you, which is impossible in the current circumstances.
Yeah, absolutely. So let's now, right, okay. So what I'm learning about screen sharing is it only brings up a certain number of screens at the same time. So you can now see my screen, yeah?
Okay.
Right, okay, so this is now the dental monitoring site. Right, okay, so let's go back to here. So this is now that young woman's images that she has uploaded onto the site. So this was on the 21st of January, okay? So here are her aligners fitting. This is her, so you'll recognize this image as being her start malocclusion. Okay, now up here, is the timeline. So this is the number of aligners, aligner 1 to aligner 14. Where you see the red, that indicates a no-go. That means the aligner has not delivered the tooth movement that's necessary to move on to the next aligner. But where you see the green, this is giving her the thumbs up to change to her next aligner. So you can see that throughout the course of her treatment, she's worn 3 aligners successfully. Then she's had to wear the 4th aligner for a little bit longer, perhaps. And then she's carried on. And perhaps the only area that we've run into difficulty is this aligner here, aligner 13, 14. Now, the likelihood is, and indeed I know that the AI has been sending her messages saying, contact your orthodontist to be seen. So something is going on here, which the AI has picked up and said there needs to be some clinical intervention. Now, of course, it's not been possible. It's not been possible for me to see her. But in an ideal world, that's what would have happened, okay? But you know, her treatment progress has been pretty spectacular. So what I want to show you now, so here is her most recent scan, the 4th of June, which as we see was only yesterday. And this is how her teeth are shaping up. So we can see that in a matter of only 4 months, her malocclusion has gone from the start malocclusion here to pretty much where I was wanting to be. So we look at her teeth now, we see somebody who's got straight teeth. We see somebody whose occlusion, whose bite has now improved. She's now got anterior tooth contact. And in addition to that, the crossbite has corrected to the extent that I wanted. So this canine has come out of crossbite, but the rest of her crossbite has remained undisturbed. So from my perspective, her treatment looks like it's a real wow. So things are going absolutely as I want them to be. Now, if I just for interest, let's have a look at the way the treatment is progressing. So I can see that pretty much the aligner is fitting really well. I can see that if I enlarge it a little bit, I can see that there's a slight void between the aligner and the tooth. And so when I see that, we can send a message, we can set up an automated message to the patient saying, just chew down. We give them little plastic things called chewies, which help the patient to chew on, to seat the aligner most effectively. So we can send a message to the patient remotely saying, treatment's going really well, but perhaps you could just focus on your chewy and use it around here. And we can send them a diagram with a little circle saying, this is where you need some attention. So let me come out of that now. So I've been able to see how her aligners fit. I've been able to see how her bite is settling. And indeed, look, you know, she's got super contact between her teeth on the right side and great contact with her teeth anteriorly. Now, we come to this scan and actually she's not biting down in this scan. So I know that this is an artificial picture of her true progress. So, but what I want you to do is I want you now to think about, I want you to keep in your mind this image. Let me just enlarge that for a moment. Okay. And I also want you to keep in mind the right side bite here. So now this is aligner 14, because the next thing I want to go back and have a look at is let's now see how the outcome compares to the prediction. So let's now go back to the ClinCheck.